In this episode of BG Dental Tips, we are going to discuss temporary veneers step by step. Stay tuned and let's go. Dear friends, this time we are going to discuss and show you in a video how to do temporary veneers, because this question is one of the most frequently asked. And we decided to give you a possibility to see everything like in a reality. Okay, so one of the main difference between temporary veneers and temporary crowns is that when you do temporary crown, you have your silicone index, you fill it with a bisacryl, you take the crown out, clean everything, use temporary cement and put it into the patient's mouth. With the temporary veneers, we cannot do this way because we have difference in insertion path in every single tooth. So basically, if you will try to remove your temporary veneers, like you have your silicone index, you fill it up with a bisacryl, then you wait, and if you will try to remove it, to bring it back with a temporary cement, it will break actually, and that's why we do not remove it. So we keep our temporary veneers as the mock-up in the patient's mouth and leave it for a while when the final restorations will be fabricated. To keep the temporary veneers for a certain period of time, I don't know how much your dental lab will take, from 5 days, maybe 7 days, 14 days or whatever, we use this tip and I would like to show you here on the video. So to stabilize our temporary veneers, we use spot edge technique or line edge technique, depending how long you would like your patient to wait with the temporary restorations. Then we rinse everything out, then I place adhesive, and we place adhesive exactly to the area where the etching gel was applied. Okay, so we place a very thin portion of the adhesive. We do not air thin it, we do not dry it, because if you will do so, what will happen, the adhesive will cover the whole surface of the patient's tooth, and then your temporary restoration will become as the final restoration. So we apply just exact amount of the adhesive to the surface that was etched, we cure it, and then we take the silicone index, we fill it with a bisacryl, we wait till the bisacryl will set, and then you remove silicone index, and since the material is still soft, you can use hand instrument like a scalpel blade 12D or any hand scaler to remove excess of material from in between teeth. If you find out that the material becomes hard, don't use the hand instrument, you will have to use a bore. And one of the best instrument in such cases is a multi-bladed carbide composite finisher bore. The one that orthodontists, for example, uses once they remove braces. There is a glue on the tooth, so they use this multi-bladed bore to remove this composite on the patient's teeth. This is how it looks like, and actually you can purchase these bores in our dental store. You can see the link on this slide. So this is multi-bladed composite finisher with a red line, or you can use a yellow line. The benefit of these bores is that they do not actually cut patient's teeth. If you will accidentally touch patient's tooth, it doesn't cut the tooth as the diamond bore. Okay, and when you use it to finish your bisacrylic restoration, the cervical area or interproximal interdental areas, the surface after this bore becomes very smooth. So basically you don't need to polish the surface afterwards. Okay, so here is the way we use this bore. As you can see, also we have the retraction cord that was used for preparations. We keep it for scanning, we keep it also for temporary restorations, and this retraction cord navigates this multi-bladed bore when we are taking out the excess. And you have to do this, what you can see here on the screen. We have to remove material in a cervical area, and also we have to remove this temporary material in the papilla zones. Because if you will forget to do that, these papillas will be pressed with a bisacrylic, and then your patient may have the black interdental triangle. Then you probably saw the cotton roll, which is soaked with alcohol. We use it to remove a monomer, and then you polish your temporary veneers as the composite restorations. You can use special or not special rubbers. You can use the discs or spirals, and then go at will brush just to make everything super polished and super nice. From the lingual surface, you would do probably the same. You can use some rubber just to remove the excess of material from the lingual side, and then you let your patient go home with this. So we do not remove it, as you can see. We place it, we wait till it sets, we partially bond it with a spot etch and spot bond technique, then we remove excess, and this is the final result of the temporary veneers, and before your patient will go home to wait the final restorations. I hope that this dental tip was useful for you and you will use it in your daily practice and have good success in temporary veneer restorations. Stay tuned and may the dental force be with you.